One of the biggest misunderstandings I encounter when talking with older adults is the belief that high blood pressure is simply a normal part of getting older. People often tell me, "Of course my blood pressure is higher. I'm in my 70s," or "Everyone my age has high blood pressure." While it's true that our bodies change over time, that statement only tells part of the story. The real truth is far more important because understanding it can make the difference between protecting your health and unknowingly putting yourself at risk. As we age, our blood vessels naturally undergo changes. When we are young, our arteries are flexible and elastic. They expand easily as blood is pumped from the heart and then return to their normal shape. This flexibility helps keep blood flowing smoothly throughout the body. Over the years, however, the artery walls gradually become stiffer. Decades of wear and tear, along with factors such as inflammation, poor diet, inactivity, smoking, and chronic stress, can accelerate this process. Imagine the difference between a brand new garden hose and one that has been left out in the sun for many years. The newer hose bends and flexes with ease. The older hose becomes more rigid and less responsive. Something similar happens inside the body. As arteries lose their elasticity, the heart must push harder to move blood through them. This often causes the top number of your blood pressure reading, known as the systolic pressure, to rise. This is where confusion begins. Many people assume that because these changes are common, they must be harmless. But common and healthy are not the same thing. Wrinkles are common. Gray hair is common. Stiffer arteries are common. Yet when blood pressure rises beyond a healthy range, it can still increase the risk of heart attacks, strokes, kidney disease, and memory problems. At the same time, there is another side to the story that is often overlooked. For years, many people heard only one message: lower blood pressure is always better. While controlling high blood pressure is extremely important, older adults have unique needs. The goal is not simply to drive the numbers as low as possible. Blood pressure that becomes too low can create a different set of problems. Think about what blood pressure actually does. It provides the force needed to deliver oxygen and nutrients to every organ in the body. The brain depends on it. The kidneys depend on it. Every cell depends on it. If blood pressure drops too much, some older adults may experience dizziness, weakness, fatigue, blurred vision, or balance problems. In severe cases, it can increase the risk of falls, which are among the leading causes of serious injury in later life. This is why understanding blood pressure in older adulthood requires a more balanced perspective. We must move beyond the simplistic idea that high blood pressure is normal and beyond the equally simplistic idea that lower is always better. Health exists in the middle ground. Another important point is that blood pressure does not exist in isolation. Two people can have the exact same reading and very different health situations. One person may be active, energetic, and free of major medical conditions. Another may be dealing with heart disease, diabetes, kidney problems, or frailty. The same number can mean different things depending on the individual. That is why modern approaches to healthy aging focus less on chasing a single magic number and more on understanding the whole person. Blood pressure is a tool. It provides valuable information, but it must be interpreted within the context of overall health, symptoms, medications, and daily function. As we continue, I want you to remember this key principle. Age-related changes in blood pressure are common, but they should never be ignored, accepted blindly, or treated without careful consideration. The goal is not to fear the numbers. It is to understand what they are telling you and what they mean for your long-term health. Because the first step toward finding your healthiest blood pressure is understanding why those numbers change in the first place. Now that we understand why blood pressure changes as we age, the next question becomes obvious. What numbers should older adults actually be aiming for? This is where many people become confused because they hear different recommendations from different sources. One article says one thing, a friend says another, and sometimes even healthcare professionals may emphasize different targets depending on a person's health situation. The first thing I want you to understand is that blood pressure is made up of two numbers, and both tell us something important. The top number, called systolic pressure, measures the force against your artery walls when your heart contracts and pumps blood. The bottom number, called diastolic pressure, measures the pressure when your heart relaxes between beats. Most of the attention in older adults focuses on the systolic number because it tends to rise as arteries become stiffer with age. For many years, people were told that a systolic blood pressure of 140 or even slightly higher was acceptable simply because they were older. Today, we know more than we did in the past. Research has shown that allowing blood pressure to remain too high can significantly increase the risk of stroke, heart attack, heart failure, kidney disease, and cognitive decline. That is why many experts now encourage maintaining blood pressure in a healthier range whenever it can be done safely. However, this is where the conversation becomes more nuanced. There is no single perfect blood pressure reading that applies to every person over 60. Human beings are not machines. We do not all come with the same medical history, the same medications, the same fitness level, or the same degree of resilience. For a healthy, active older adult, a systolic pressure around 120 to 130 may be an excellent target if it is achieved comfortably without side effects. But for someone who is frail, experiences dizziness, has multiple chronic conditions, or is taking several medications, a slightly higher reading may actually be safer and more appropriate. This is why individualized care matters so much. One of the biggest mistakes people make is becoming obsessed with a single blood pressure reading. They check their pressure one morning, see a number that is higher than expected, and immediately assume something is terribly wrong. In reality, blood pressure is constantly changing throughout the day. It responds to physical activity, emotional stress, sleep quality, hydration status, medications, caffeine, pain, and even the simple act of climbing a flight of stairs. Think about it this way. If you step on a scale once after a large meal, that number does not define your overall weight. In the same way, one isolated blood pressure measurement does not define your cardiovascular health. What matters far more is the pattern over time. This is why home blood pressure monitoring has become such a valuable tool. When measurements are taken consistently under similar conditions, they provide a much clearer picture of what is actually happening. Instead of reacting emotionally to one reading, you begin to see trends. You can identify whether your pressure is generally stable, gradually rising, or responding well to lifestyle changes and treatment. Another factor that deserves attention is how you feel. Numbers are important, but symptoms matter too. An older adult with a blood pressure reading that looks perfect on paper but feels weak, dizzy, exhausted, or unsteady may need a different approach than someone who feels energetic and strong. The goal is not simply achieving an impressive number on a chart. The goal is protecting health while preserving quality of life. This is where wisdom often replaces rigid rules. Good blood pressure management is not about winning a competition for the lowest reading. It is about finding a range that supports healthy circulation, protects vital organs, and allows you to stay active, independent, and mentally sharp. When you start viewing blood pressure this way, the fear begins to disappear. You stop chasing isolated numbers and start focusing on long-term patterns. You recognize that context matters. You understand that successful blood pressure management is not measured by a single reading, but by the overall picture of your health. And that perspective becomes especially important when we begin discussing what can happen when blood pressure is pushed lower than the body can comfortably tolerate. At this point, many people are surprised to learn that while high blood pressure certainly deserves attention, blood pressure that becomes too low can also create serious problems, especially in older adults. This is a topic that often receives far less discussion than it should. For years, the public message has been simple: lower your blood pressure. And while that advice has helped many people reduce their risk of heart disease and stroke, it has also led some individuals to believe that the lowest possible number is automatically the healthiest number. The reality is more complicated. Your body relies on blood pressure to deliver oxygen and nutrients to every organ and tissue. Think of blood pressure as the force that keeps life's supply chain moving. Without enough pressure, blood cannot efficiently reach the places that need it most. The brain, heart, kidneys, and muscles all depend on a steady, reliable flow of blood to function properly. When blood pressure falls too low, the body may begin sending warning signals. One of the most common symptoms is dizziness, particularly when standing up from a chair or getting out of bed. Many older adults dismiss these episodes as a normal part of aging, but they should never be ignored. That brief moment of lightheadedness can be a sign that the brain is not receiving adequate blood flow during the transition from sitting to standing. For some individuals, the symptoms extend beyond occasional dizziness. They may experience unusual fatigue, weakness, lack of energy, blurred vision, or difficulty concentrating. Others describe feeling unsteady on their feet or finding that their balance is not what it used to be. These symptoms are not merely inconveniences. They can significantly affect independence, confidence, and quality of life. Perhaps the greatest concern is the increased risk of falls. Falls are among the most serious health threats facing older adults. A fractured hip, broken wrist, or head injury can change the course of a person's life in a matter of seconds. When blood pressure drops too low, especially after taking medication, standing up quickly, or becoming dehydrated, the chances of falling increase substantially. I often encourage people to think beyond the numbers on the blood pressure monitor. Imagine an older adult whose blood pressure appears perfect according to a chart. The reading looks impressive. The doctor sees a low number and feels satisfied. Yet that same person feels exhausted every day, struggles with dizziness, and worries about falling whenever they leave the house. Is that truly a successful outcome? Most people would agree that it is not. Health is not defined solely by laboratory values or monitor readings. It is measured by how well the body functions in everyday life. Can you walk confidently? Can you think clearly? Can you remain active and independent? Can you enjoy time with family and friends without feeling weak or unsteady? Those questions matter just as much as any number. Another important consideration is that older adults often take multiple medications. Sometimes blood pressure medicines interact with other treatments or become too powerful as the body's needs change. Weight loss, dietary improvements, increased physical activity, or changes in kidney function can alter how medications affect the body. A treatment plan that worked perfectly 5 years ago may not be the ideal plan today. This is why regular monitoring and ongoing conversations with healthcare providers are so important. Blood pressure management is not a one-time decision. It is an ongoing process of adjustment and observation. The goal is to find a range that protects against the dangers of high blood pressure without creating the equally important risks associated with pressure that is too low. What makes this especially challenging is that every individual responds differently. Some people feel perfectly fine with lower readings, while others develop symptoms even when their numbers appear acceptable on paper. That is why personal experience and symptoms must always be considered alongside the measurements themselves. The most effective approach is not extreme control, it is balanced control. The healthiest blood pressure is not necessarily the lowest one you can achieve. It is the one that allows your heart, brain, kidneys, and entire body to receive the circulation they need while keeping you strong, steady, and capable of living life to the fullest. And once you understand that balance, you can begin focusing on the daily habits that naturally help your body maintain it. Now that we've talked about why blood pressure changes with age and why both excessively high and excessively low readings can create problems, the next question becomes incredibly important. What can you actually do about it? The encouraging news is that some of the most powerful tools for supporting healthy blood pressure do not come from a prescription bottle. They come from everyday habits that influence your cardiovascular system hour by hour, day by day, and year by year. One of the most effective habits is simply moving your body consistently. I know many older adults believe exercise has to be intense to be beneficial, but that simply isn't true. In fact, some of the greatest benefits come from regular, moderate activity. Walking remains one of the most underrated forms of exercise available. A daily walk helps improve circulation, strengthens the heart, supports healthy blood vessels, and assists the body in regulating blood pressure naturally. The key is consistency rather than intensity. A person who walks for 30 minutes most days of the week often experiences greater long-term benefits than someone who pushes themselves through an exhausting workout once every few weeks. Movement sends a signal throughout the body that the cardiovascular system needs to remain efficient and adaptable. Strength training also deserves attention, especially after the age of 60. As we grow older, we naturally lose muscle mass unless we actively work to preserve it. Strong muscles improve metabolism, support balance, enhance mobility, and contribute to overall cardiovascular health. This doesn't necessarily mean lifting heavy weights. Resistance bands, light dumbbells, body weight exercises, or even chair-based strength routines can make a meaningful difference. Another factor that many people underestimate is sleep. Poor sleep places tremendous stress on the body. When sleep becomes fragmented or insufficient, stress hormones can remain elevated for longer periods. Over time, this can contribute to rising blood pressure. Many older adults accept poor sleep as an unavoidable part of aging, but improving sleep quality often produces benefits that extend far beyond feeling rested. Better sleep supports heart health, brain function, immune resilience, and blood pressure regulation. Stress management is equally important. Modern life creates countless sources of tension. Financial concerns, health worries, family responsibilities, and daily frustrations all activate the body's stress response. In short bursts, stress is normal. The problem arises when the body remains in a constant state of alertness. When stress hormones stay elevated, blood vessels can constrict and blood pressure may increase. This is why activities such as deep breathing, prayer, meditation, spending time in nature, reading, gardening, or simply enjoying meaningful conversations can have a surprisingly positive impact on overall cardiovascular health. The goal isn't to eliminate stress entirely. The goal is to create regular opportunities for the body to recover from it. Hydration is another area that often gets overlooked. Many older adults drink less water than their bodies need, sometimes because their sense of thirst diminishes with age, or because they worry about frequent trips to the bathroom. Yet dehydration can affect circulation, energy levels, and blood pressure stability. Maintaining appropriate hydration helps support healthy blood flow and allows the cardiovascular system to function more efficiently. Nutrition also plays a central role. Small dietary choices repeated every day eventually become powerful influences on health. Excess sodium can contribute to elevated blood pressure in many individuals, particularly those who are sensitive to salt. At the same time, foods rich in potassium, fiber, and other essential nutrients help support cardiovascular function. Fruits, vegetables, beans, nuts, seeds, and minimally processed foods provide the body with many of the tools it needs to maintain healthier blood pressure naturally. What I find most encouraging is that these habits do not operate independently. They work together. Better sleep often improves energy for exercise. Regular activity helps reduce stress. Reduced stress can improve sleep quality. Improved nutrition supports energy and recovery. Each positive choice strengthens the others. This is why lasting success rarely comes from searching for a quick fix. It comes from building a lifestyle that consistently supports the body's natural ability to regulate itself. The changes do not have to be dramatic. In fact, the most sustainable improvements are often the simplest ones repeated faithfully over time. Because when it comes to healthy blood pressure, the habits you practice every day are often more powerful than the decisions you make once in a while. As we bring everything together, I want to leave you with what may be the most important truth of all. Throughout this discussion, we've explored how blood pressure changes with age, why high blood pressure should never be ignored, why blood pressure that is too low can also create problems, and how daily habits can support healthier numbers naturally. But if there is one message I hope stays with you long after this conversation ends, it is this: there is no single perfect blood pressure number for every older adult. Many people spend years searching for a magic number. They want a simple answer. They want someone to tell them exactly what reading guarantees perfect health. Unfortunately, the human body does not work that way. Health is far more individual than most people realize. The best blood pressure for you is not necessarily the best blood pressure for your neighbor, your sibling, or even someone the same age. Two people can both be 75 years old and have completely different health needs. One may be physically active, walking several miles a day with strong muscles and excellent cardiovascular fitness. Another may be managing diabetes, kidney disease, arthritis, or other chronic conditions. Their bodies may respond very differently to the same blood pressure target. This is why the most effective healthcare professionals look beyond the numbers alone. They consider the whole picture. They ask important questions. How is your energy level? Are you experiencing dizziness? Do you feel steady when you walk? Are you sleeping well? Are your medications working without causing unwanted side effects? Are your kidneys functioning properly? Is your heart healthy? Can you continue living the life you want to live? Those questions often reveal more than a single blood pressure reading ever could. One of the greatest mistakes people make is assuming that success means achieving the lowest number possible. In reality, successful blood pressure management is about balance. The heart needs protection from excessive pressure. The brain needs adequate blood flow. The kidneys require healthy circulation. Muscles need oxygen and nutrients. Every organ in the body depends on maintaining that delicate equilibrium. That is why I encourage older adults to become active participants in their own health. Do not simply look at your blood pressure readings and move on with your day. Pay attention to patterns. Notice how you feel. Keep track of changes. Monitor your numbers consistently rather than obsessing over isolated readings. Home blood pressure monitors have made this easier than ever before. When used properly, they provide valuable information that can help you and your healthcare provider make more informed decisions. Over time, patterns begin to emerge. You can see how your body responds to exercise, dietary improvements, stress reduction, medication adjustments, and changes in routine. These patterns are often far more meaningful than any single measurement. It is also important to remember that blood pressure management is not a destination. It is a lifelong process. Your body's needs at 60 may not be the same as your needs at 70 or 80. Circumstances change, health conditions evolve, medications may need adjustment. The healthiest approach is one that remains flexible and responsive over time. Perhaps most importantly, never lose sight of the ultimate goal. The goal is not to impress anyone with a number on a screen. The goal is not to win a competition for the lowest reading. The goal is to preserve your quality of life. Healthy blood pressure should help you stay active. It should help you maintain your independence. It should help protect your memory, support your mobility, and reduce the risk of serious cardiovascular events. Most of all, it should allow you to continue doing the things that bring purpose, joy, and meaning to your life. When you understand that principle, the conversation about blood pressure becomes much less frightening. It becomes less about chasing perfection and more about creating sustainable health. You begin focusing on what truly matters, finding the range that keeps your body functioning at its best while allowing you to feel strong, confident, and capable every day. And that is the real truth about blood pressure in older adulthood. The best number is the one that helps you live the longest, healthiest, and most fulfilling life possible.